Tomorrow, obviously a big day, but we've already passed one of the biggest days of the year. As people head home for Christmas, the rush to get a COVID test is really ramping up. But should you get a PCR test or a rapid test? What if you can't find a rapid test? Long lines are taking over COVID testing clinics all across the country, including here in Indiana. An at-home test shortage is also leaving stores like CVS, Walmart, Walgreens, even Amazon with empty shelves.
Very frustrated. I've been looking for a test for about all week, actually, for a few days now.
Now, earlier this week, our own 13 Investigates team checked in on 8 different stores around central Indiana. Only one location had a test on the shelf.
We sold 12 of them in the first half an hour that we were open today, so this is the last one we have. We're saving it for somebody.
Making the problem worse is some of the confusion over which tests people should take, rapid or PCR.
It's kind of just confusing on what's actually correct and what I need to get to be able to go home for Christmas, see my family, all that stuff.
These 10 over-the-counter at-home COVID tests are FDA approved. They offer quick results in about 15 minutes and should give you an accurate idea whether it's safe to attend holiday gatherings.
The right thing to do if you want a rapid, time-sensitive assessment of whether or not you are infectious right before you go into a gathering.
Then there is the PCR option, which you do have to get at a clinic. Experts say they're the most accurate and should be your go-to when deciding when to travel or go back to the office after the holidays. So if you're looking for a rapid test but can't find one because of the high demand, stores say your best bet is just checking in each day to see if a new shipment arrives. And if you're relying on a PCR test, keep in mind those results can take a few days to come back. Well, if you have a rapid test and plan to take it before the holidays, doctors say the key is taking it at the right time. They recommend maybe 20 minutes to a half an hour before your gathering. That should give you the most accurate gauge on whether you're at risk of getting others sick, especially with the shortage. Don't waste a test if you're already feeling sick or have the start of symptoms. At that point, it's just best to assume you're positive and isolate yourself, then maybe use the test on day 2 or 3. Well, the FDA has approved a COVID pill treatment for emergency use for the second day in a row. This one's from Merck. This one is called Molnupiravir. Molnupiravir, that's a new name we'll apparently start hearing. And it can also be used at home to treat mild to moderate COVID in adults. It must be taken within 5 days of a positive test. Now, data shows it can cut the risk of hospitalization or death by 30% for people considered high risk. And a new study shows you're at lower risk of hospitalization if infected with the Omicron variant. So this research from London's Imperial College found the risk of any visit to a hospital with Omicron was 20 to 25% lower than with Delta. That followed a study out of South Africa this week. It found people diagnosed with Omicron were 80% less likely to be admitted to the hospital than those diagnosed with another variant. But right now, many of our hospitals across central Indiana are filling up with more COVID patients than they've ever seen during this entire pandemic. That's why President Biden sent military medical help to Indiana. Our Emily Longnecker explains what that looks like for IU Health.
The number of COVID patients IU Health is dealing with right now at all 16 of its hospitals is enough to fill up all of the beds at this hospital, Methodist downtown. They've got the space. It's the staffing that's the challenge. That's why IU officials say this team here sent from FEMA will make a big difference.
A team of 20 doctors, nurses, and respiratory therapists from the United States Navy will be working here at Methodist Hospital for at least the next month. The goal, help the staff be able to care for more Hoosiers during what's turning out to be the largest number of COVID patients in IU's health system since the start of the pandemic.
We are short and our providers are tired and caregivers are tired, and they've been working extra hours and taking care of more patients over the last 2 years than ever.
The FEMA team is here to help where needed. Right now, they're on site learning how IU's system works.
And when the hospital agrees that our team is ready to be integrated fully into the system, that's when we proceed with beginning our whole mission and beginning to treat patients as part of the team.
The FEMA team isn't the only help IU Health is getting in the fight against COVID. The Indiana National Guard has been working across all of the hospital system since the beginning of the month, and now the FEMA team adds to that support.